Hey, Dr. Alan Christianson here with you. So this is an unusual topic, but I want to talk about cannabinoid hyperemesis syndrome. It's something that if you're not aware of, you probably will be. So to put some quick context on this, a lot of people now are using marijuana medically and or recreationally. And many feel that that's helpful for them in terms of pain or mood changes or nausea or whatnot, and so be it. But there's a subset of people who respond badly to this. And it's a really weird condition because it's not apparent. In fact, it's almost made to be missed, it seems. There's some things in life to where you put your hand on a hot stove, for example. Oh, yeah, you know what did what, and it's obvious, and you won't do that again. But there's some things that are just deviously unclear. And this one, so there's this condition in which there's abdominal pain, like severe pain, nausea, vomiting, and it's often better with the short-term use of cannabis products. And here I'm talking about CBD, THC, marijuana, chewables, vapes, gummies, edibles, you name it, throw it all together, it can all trigger this thing. And what happens is that over time of exposure, your endocannabinoid pathways become dysregulated. In your brain and your gut, the timing gets disrupted because of the chronic exposure to cannabinoids. And in the short term, a higher dose of cannabinoids stops it for a little bit, but the chronic ongoing exposure is what's driving this. I first saw this medically many years ago, and I was completely baffled. I did not know what was happening initially. Someone had these symptoms. They were dehydrated, they were losing weight, they were frantic because of it. And they didn't have any of the signs or the findings you would expect with other causes of abdominal pain, ectopic pregnancy, appendicitis, intussusception, you name it. There was really no issues there. They had already had some ER trips. But it turned out that they confided in me that the symptoms were much better after marijuana exposure. That seemed to alleviate it. Now, I didn't think that could possibly be the cause, but another trip that they took to an urgent care, this doctor pretty much identified it immediately. He realized what was going on and tested and found that was the culprit. So the person struggled with symptoms for another few weeks, but they did completely abstain from cannabis products. And that was difficult because they found it helpful just in general. They liked the way it helped their anxiety, but also because it did give them short-term alleviation of their digestive symptoms. So they toughed it out and they got better. And they saw so many ways in which it was affecting them that they really weren't clear on. Now, how common is this? Well, this is pretty staggering, but stats, we've got about 330 million Americans, and stats suggest that about a quarter of Americans over 12 use marijuana annually. And daily, that's about 17 to 20 million people that are using it daily, adults. Now, this cannabinoid hyperemesis syndrome, it doesn't usually come on quick. It's often at least after several months, but it may be many years. So you may use marijuana products for years and do totally fine, and this thing comes out of the blue. But it's expected that about 6 to 10% of regular users, those where it's daily or almost daily, will develop this. So 6 to 10% of 17 million people. So what that means is we're talking about like 1 to 2 million Americans who are going to be experiencing this, like a lot of people. And again, it's not something that the public is aware of. The symptoms are not very specific, and the cause does not make sense because the actual cause of it feels like that's the thing that's helping it. And then also these symptoms overlap with many other medical conditions. Other problems, people are often hesitant to talk about the fact that they're using cannabis products. The person who I identified this with didn't disclose that to me right away. And this can be misattributed for other things as well, cyclic vomiting syndrome, irritable bowel syndrome, you name it. And again, the mechanism is this disruption of the endocannabinoid system. So THC, CBD, they both interact with that. And that's why some believe that they're helpful in terms of just digestion, stress response, or mood. But for some people, the chronic use can make this whole timing system dysregulate, and it can alter the whole motility, the whole movement cycle of the gastrointestinal tract. And basically, it's disrupting the timing and making it to where the normal rate of movement downwards become altered. And that's what nausea and vomiting become. So when do you think about this? Honestly, anyone who's a regular user of cannabis products. A classic thing is someone who's used them for years or someone who is suddenly change to a more intense version, like they've gone on to a medical form or a higher concentration. Now, a classic situation is these episodes last for about 24 to 48 hours, and they come on every few weeks or every few months. So they're not all the time. In fact, most of the time, people who have this cycle, they feel fine. But then every few weeks, every few months, it will hit them, and they'll have a day or two where it's out of control. And it's severe abdominal pain, cramping, diffuse, not better. There's a couple of unusual specific symptoms with this, one of which is that people may stumble upon the fact that they often feel better in the short term through heat exposure. And so some do these chronic, recurrent, long, hot showers or hot baths during the episodes. And it's useful. And there's some kind of elaborate ways by which heat on the skin, the cannabinoid systems, why it can help them break that cycle temporarily. So, how is this diagnosed? Honestly, it's really if someone is regularly using cannabis products, they've got these cycles like this, and especially if the hot water is helpful, that's basically what's happening. And ultimately, someone does need to rule out other causes as well and make sure that there's not other medical problems that are really behind this that could be acute abdominal issues. And some, to where it's very bad, may need some intravenous fluids to help with electrolyte loss or dehydration. Sometimes anti-nausea medications can be useful as well. But ultimately, this is really long-term abstaining from all cannabinoid products. Even small amounts can trigger recurrence. And that can be tough because once someone has had this cycle happen, it might have been that nothing really came on for years and years and years. But once it does come on, it's expected to come back almost right away with future exposure. So, again, the tough thing is that the symptoms aren't right after use. They're often better and resolved after use. And they may not come on for the first several years of use, even. So, the solution is just long term avoidance of cannabis products. And it may not help immediately. It might take a few months to see a full change of these symptoms. But again, it's a really devious thing. It's going to be crazy common. There's already so many that have experienced this, and no one's really thinking about it or being on the lookout for it. So if you're someone who's found cannabis products, even CBD products or THC or edibles, if they've been helpful for you, okay, so be it. But if you develop symptoms like this, even years later, please be aware that this could be endocannabinoid hyperemesis syndrome. This is more common and expected to rise rapidly. Please tell your friends about this. If they mention about just the use of cannabis products or encouraging that, just let them be aware of that. Let them be informed about that. Share the video with them, share the information with them. If a loved one talks about any of these symptoms, just see if they may be having exposure to cannabis as part of it. This is a big problem, and there have been some tragic cases where it's been diagnosed far too late, and there's just less awareness than there should be. So spread the word. All right, take good care. Bye-bye.